Yellow fever cannot be eradicated, but the risks of epidemics in human populations can be prevented if at least 80% of the people who are at risk are protected through a vaccine that provides lifelong immunity. Yellow fever has the potential to cause devastating outbreaks that can be exported internationally, especially from urban settings, posing a threat to global health security. With concerted efforts and innovative approaches, the risk of yellow fever epidemics can be eliminated sustainably.
To eliminate the risk of yellow fever epidemics, we need to make sure that we're getting the vaccine to the right people. And this includes protecting the children missed by routine immunization in countries with challenged health systems who have now become adolescents or young adults, and protecting also the migrant and hard-to-reach communities that were missed by previous campaigns and are now affected by outbreaks. Getting the yellow fever vaccines to the right people also means protecting the workers with occupational exposure that work in extractive industries, both formal and informal. Climate change is also likely to increase yellow fever cases, especially in regions that were previously less affected. And to mitigate yellow fever urban risk and limit exploitations, we're developing actionable, practical guidelines, trainings, and workshops that are yellow fever specific, but must be integrated into broader cross-cutting strategies and plans.
The peculiarity of the epidemiological situation in the Americas is that cases are due to selvatic transmission cycle. So this the yellow fever basically is mostly affecting non-human primates, and it usually generates human cases in a sporadic way in rural areas, and more specifically in the jungle or in the Amazon region. However, because of the deforestation and the growing of cities throughout the forest, there is a proximity between non-human primates and humans that is like closer and closer, basically. And this leads to cases in peri-urban settings, and it also brings the virus closer to urban vectors. Based on the midterm evaluation, there were like a number of challenges that were highlighted for the region of the Americas, among which some are very common to other regions, with a suboptimal routine immunization coverage, especially among high-risk areas and hard-to-reach populations, in particular in those rural areas. The difficult identification and timely reporting of suspected cases, as well as the timely investigation of those cases, human resource capacity, and the need to train more human resources to respond to yellow fever outbreaks, and obviously a large problem of funding for these activities. It was also important to highlight the importance to foster cross-regional collaboration and within the region of the Americas, collaboration between countries and exchange of experiences, especially around surveillance among non-human primates, because we have cases that are due to a selvatic transmission cycle. It's very important to be able to detect the transmission among monkeys in order to predict transmission among humans.
There have been various successes in Africa, and I would like to highlight three: around strong vaccination efforts, strengthening of surveillance and laboratory capacities, and rapid containment of yellow fever outbreaks. In terms of vaccination efforts, 59% of the yellow fever high-risk countries in Africa have completed preventive mass vaccination campaigns. And at least this has been alluded to earlier, 377 million people on the continent have been vaccinated against yellow fever, including more than 264 million during campaigns. And 25 of the 27 countries on the continent that are at high risk of yellow fever have introduced yellow fever vaccination into their routine immunization schedule. In terms of surveillance and laboratory capacity, the Transforming African Surveillance System flagship initiative was launched in 2022, and so far, 19 out of the 26 yellow fever high-risk countries on the African region, the other one, Sudan, is in the Eastern Mediterranean region, have commenced the TAS IDSR acceleration. Also, laboratory diagnostic capacity for yellow fever has been set up in 29 national public health laboratories across 24 yellow fever high-risk countries. And 3 of our laboratories are reference laboratories in Cameroon, Senegal, and Uganda. The immediate actions that we are planning are strengthening regional collaboration, advocacy, and engagement among all stakeholders, countries, and partners. We also want to improve the implementation of the various strategies, including the Addis Ababa Declaration on Immunization, the Immunization Agenda 2030, and various regional strategies like the investment case on immunization, which would, while improving immunization broadly, will also help with the control of yellow fever. We want to protect high-risk workers. We will be strengthening capacities of yellow fever surveillance and epidemiologic investigations, and we want to build resilient urban centers and establish preparedness plans. In the long term, we want to sustain vector surveillance and control programs in cities, and we want to advocate with our governments to ensure that our African governments provide funding for their respective eye strategy implementation plans.
Ethiopia is among the top 10 countries with a high number of zero dose as well as under-vaccinated children. Again, Ethiopia is also the second from Africa, following Nigeria, with a high number of zero dose as well as under-vaccinated children. The country have prepared a detailed big catch-up vaccination plan, and that is being implemented in the country in all regions with a great success. Yellow fever is among the 36 diseases under surveillance by EPHI. There is also a national diagnostic facility in the country, and there is an outbreak management guideline. The country have been also facing a couple of outbreaks and have implemented outbreak response activities, which includes reactive vaccination campaign in those affected area. Yellow fever is also a requirement for travelers traveling outside the country. And now the country is excited, looking forward for the largest vaccination drive ever, because this yellow fever vaccine introduction is really the biggest ever, because it targets a wide age range, especially in PMVC. So that is also going to be used as an opportunity to integrate other services. The National Yellow Fever Eye Strategy Plan, actually the goal is to eliminate yellow fever epidemics in Ethiopia by 2030. The objectives are to provide routine yellow fever vaccination to children at 9 years of age, starting from 2025, and also to provide yellow fever vaccine for the population which is 9 months to 59 years. So the request for partners is actually to support, to provide financial support to cover the gap, as well as to support in providing technical assistance to the country.
terms of the number of vaccines administered, almost 500 million through Gavi support, and over $1 billion that's been invested to do that. This is a huge impact in terms of deaths averted, over 2 million deaths averted.
Our success to date are down to how we have been able to collaborate since 2017 to reduce the catastrophic risks of yellow fever against the backdrop of many competing priorities. Through the efforts of this partnership, more than 260 million people in Africa have been protected for life through vaccination campaigns since 2017. The target date of achieving the goals of the eliminating yellow fever epidemic by 2026 is now less than 2 years away, and failure is not an option. We should do all our best to be able to reach the last mile and to really encourage countries, the large ones, to be able to do their preventive campaigns and introduce the vaccine into their routine immunization.